The theme for this year's Spinal Cord Injury Conference is supporting patients with spinal cord injury beyond the specialist units. And we're finding, and the literature supports, that the majority of people with spinal cord injury now are not being treated at one of the 8 specialist regional spinal injury centres in England. They're being treated elsewhere, and that's partly because the UK population has grown, the incidence of spinal cord injury has grown, the average age of people with spinal cord injury has risen, more people are surviving spinal cord injuries, but the number of specialist spinal cord injury beds has stayed relatively constant. And so now studies suggest that only a third of patients with new spinal cord injuries are receiving their acute treatment and rehabilitation at specialist centres, which presents real problems both for patients and for the NHS. And so we're having a conference today, and our speakers are going to address what can be done to meet the challenges of making sure these patients still receive the best care and the best rehabilitation following spinal cord injury.
So I suppose the key takeaway for me is that we've developed this network model of care, which is a hub and spoke model, that we have placed spinal injury practitioners into our major trauma centres that then will go and outreach and make sure that every patient within the West Midlands is seen weekly as a minimum face-to-face. They deliver education to the nursing staff, to the patient, to the family. They're there to give information. They're also there to give psychology support, and they will also signpost to any of the agencies that we have out there that can offer them support.
So we're looking at the mismatch between the number of referrals into the spinal centre and the ability for the spinal centre to admit those individuals. And one of the good strategies that has helped that is having spinal cord injury practitioners or link workers at major trauma centres who can support to identify appropriate individuals who need input, and also to provide that just-in-time education and ensure that they're on the right path for their bladder and their bowel management at the first stage, and that they've got a good positioning regime in place so that they're less likely to develop secondary complications, either while they wait to come into the unit or while they have their rehab more locally.
I think there's no doubt that within the spinal cord injury service within England there's a need to look at new models of care. I'm not convinced that we know yet what those new models of care should be, but there's no new capacity in the regional spinal injury centres, and there's not going to be any new capacity. So we need to look at collaborative models with district general hospitals, but we've got to get the model right so that the patients are cared for in the right way.
Well, I was talking about bladder and bowel management, and actually it was really interesting how engaged the audience was and how much they wanted to ask questions on some of the more complicated cases, like cauda equina, for example, and incomplete injuries. So I think this is something which needs more work, and that was really nice to hear that everyone was on the same page with that. I think my takeaway with bladder and bowel management is always going to be routine. We need to support our patients in their routines and encouraging them that regularity is the main way of staying continent.
Well, the most important thing when it comes to pressure ulcers is prevention, because prevention is always so much better than cure. The problem with the pressure ulcers is if our patients get them and they're not managed properly, it can impact on our patients in such a huge way that can leave them on bed rest for weeks, months, sometimes years, which essentially makes them a prisoner in their own homes. Not only is it a problem in terms of managing the pressure ulcer, but if and when that pressure ulcer heals, there's then a huge risk of those pressure ulcers recurring further on down the line. And if it's in a young patient, that can happen many, many times over their lifetime. In addition to the recurrence of the pressure ulcers, if the patient has to look after that area that's been damaged, they then transfer the weight somewhere else, and that gives them a risk of another pressure ulcer in another part of the body. So prevention is better than cure.
Well, I've been doing this work for more than 30 years, and I thought I knew quite a lot about it. think I do really. But I come along to an event like this and I always learn something. One thing I learned was the vital importance of bowel and bladder care and some of the matters that those who care for those with spinal cord injury have to be really skilled at. The other thing I came away with was recognising, again, I think I knew it already, but it reinforced it, was the importance of psychological assistance and understanding what happens in someone's life when they have an injury of this kind. Again, I'm fairly experienced in it, but to listen to Jane Duff from Stoke Mandeville and the importance of ensuring that there's psychological care available really made me think that we need to pay more attention to it in litigation.
Yeah, it's been a really fascinating day, and I think when Stewarts first got in touch and asked me to be on the panel, when I'd actually looked at the timetable of events and the people that were speaking, I wanted to come from the start, so I actually ended up coming from the start of today's session. So yeah, I think, you know, I don't think we do enough of these sessions where you're speaking to experts in the field. So yeah, so it's been really informative. I've learned something new, and I've been spinal cord injured for 8 years. Catching up with people from the medical profession and obviously speaking to fellow spinal cord injured patients as well. So yeah, so it's been a really good day. And I think, you know, the fact that everybody's turned up and people are still around kind of shows how successful the day has been. So well done to everyone at Stewarts, and thanks again for thinking of me and inviting me to be a speaker on the panel.
So I think what was fascinating was, one, to see the wide range of people who are here and to hear about the different and the very different experiences in sort of across the country. But what also came across was the challenges were similar, but the solutions appear to be developing differently, which I think is sort of is indicative of a healthy ecosystem of thinking. And as was talked about, you know, sort of at the very end, and in response to the question that Kevin raised, I think there is a lot to, you know, sort of consider from what we heard. And as, you know, sort of as we go forward, I'm hoping that we will see some of this being consolidated into plans that can actually make a difference to patient care and patient pathways, because it continues to be a real problem. And I think some of the challenges that were highlighted today are genuine challenges which do not necessarily lend themselves to easy answers.
So my experience of working as a clinical psychologist is how crucial people developing self-management skills are in skin management, bladder management and bowel management. And that translates, they can be thought of as very separate things that are just functional skills to gain, but it actually translates into how people are going to live their lives after spinal cord injury, whether they're going to be isolated at home, whether they're going to return to work, whether they're going to be confident in going out and about in society. So those skills are crucial skills to gain, that personal knowledge about how I'm going to manage this now that I have a spinal cord injury, and how I'm going to translate that when I leave hospital and when I'm kind of living my life. It's a really key take home for me today.
The key takeaway for me from this conference is the fact that there are so many knowledgeable people out there with lots of different skills and specialties, in that we got to move away from working within silos, and if there's any way that we can provide a good, stable platform so that we can be sharing our knowledge and resources so that we can be improving the care continuum across the board. You know, there are so many specialties and so many people out there that we can learn from. If there's ways that we can work outside of our own scope of practice, so don't be working just within your institution. Look at what else is out there from an external point of view, whether that's going to be NHS or whether it's going to be from charities or companies. I think we can all learn from each other, and there is so much more out there that we can give that's going to improve patient care, which is something that we have to aspire to, that if we're going to be able to, particularly with the spinal cord injury patients, have something that's going to be a little bit more meaningful for them. We've already touched on the fact that these are highly complex but low volume patients, but it doesn't mean to say because they are low volume that they do not matter. I think they've got their greatest complexities in some respects, not just physically but from a mental health point of view. How can we, going forward, be able to work together in a more dynamic way and take the innovation forwards from the spinal cord injury community, really, so that we can help shape care for the future that's going to be fit for purpose, not just for the NHS, but beyond the NHS on to discharge.